India is facing a second COVID-19 wave, a year since the start of a nationwide lockdown that's left millions jobless. Around 260,000 new cases have been reported over the past week. That's the highest number in 4 months. Maharashtra is the epicentre of the new outbreak. It accounts for nearly 70% of new cases. Experts say that people aren't following virus safety protocols. They're calling for a massive upscaling of India's vaccination drive. Fewer than 4% of India's 1.4 billion people have received at least one dose. Rebecca Bundan joins us live now for more. Rebecca, can India cope with this new surge?
Certainly, it's seen as a big worry that the numbers are rising like this. But if we look at the figures, more than 46,000, that's still significantly less than the peaks that we were seeing last year in September, when they were approaching almost 100,000 new COVID-19 infections that were confirmed each day. But what's really alarming is the fact that about 2/3 of these new active cases are being seen in one state, which is the state of Maharashtra, where Mumbai is located. And doctors are saying that this is due to people not following COVID precautions like wearing masks and following safe distancing rules. Some doctors also say that new variants of the virus could have a role to play that are more contagious, which is why it's spreading more quickly. But clearly, if these cases continue to rise as they are in the state, that is going to put pressure on hospital resources, on hospitals and staff, particularly if a number of people do need to be hospitalized. So that is a concern, and authorities here are taking measures. In the state of Maharashtra, there were some lockdown measures that were put in place in some districts of the state. Mumbai is also taking its own steps. From today, local authorities have said that shopping malls and train stations and other crowded areas should be testing people randomly, and these would be mandatory tests, which are the rapid antigen tests before they're allowed to enter. So that's a significant step, but perhaps a controversial one that's been taken to try to bring this situation under control. Also, the vaccine drive is continuing, but a lot of people are saying that does need to be ramped up to actually have a significant impact.
Rebecca, help us understand why the inoculation rate in India remains low, despite the fact that the country is the world's biggest vaccine maker.
That's right. So the vaccine drive in India started in mid-January. What we have to remember is that it's still only open to limited people in India. It's not open to everybody. So it started with frontline workers, health workers, the police and so on. And then at the beginning of this month, it was opened up to the over 60s and to over 45s who have underlying health conditions. So it's still not open to everybody. And that's a significant reason why the numbers are still relatively low. Another factor, of course, in terms of the slow start to the drive was because of vaccine hesitancy. People were a bit worried about taking the vaccine, particularly the homegrown Bharat Biotech jab, when data wasn't publicly available. But since then, it seems that people have gained a lot of confidence, and there's been a lot of demand. Vaccination centres are saying that they are seeing a lot of demand from people who are eligible to actually have the jab. So that seems to have improved. But there's also some criticism as well, because India has actually been exporting more vaccines than it's been delivering to its population. So that's another issue. But what we do have to remember is that with these doses, even if it does produce more doses, India also needs to ramp up the facilities, the vaccine centres, the staff there to be able to give out more vaccines. And that's something that's working on at the moment before it opens up to more members of the public.
Rebecca, thank you very much for that update. Rebecca Bundan there, live for us in Mumbai.